So I just want to really quickly show a self-care technique that you can use when you have migraines. First of all, I want to say if you've tried self-care techniques for pain and they didn't work, don't give up. The thing is that if it was that easy, then I could just give everybody who walked in the door with migraines the same treatment. But there are actually so many different patterns that it makes perfect sense if the majority of the self-care techniques that you use don't work. It's all about finding what works for you and finding your pattern. Secondly, so this is tapping. Tapping is when you find a point and you tap it. These are acupuncture points and we stimulate them by tapping. There are other ways to work with those points besides tapping. And I'll go after going over some points with you, I'll show you how you can work with them without the actual tapping part, if that doesn't resonate with you. Secondly, how to tap. Well, it's pretty straightforward, right? You're tapping the point. The thing is, acupuncture points don't just exist in the body, but they also exist outside of the body. There's the energy body, the electromagnetic field, which is well known in science. So what I like to do is to find the rhythm. You just feel the energy in that electromagnetic field. So it'll push your hand away and then at some point pull it back. So it's nice to follow that rhythm. And if you find it, at some point, it'll push you away. Maybe when that point is done or when you don't need to tap that point anymore, it'll push you away and then you can go to the next point. So the first thing before you start tapping is ask yourself on a scale of 1 to 10, how bad is this pain right now? And by the way, this is not just for headaches, it's not just for pain. You can use it for anxiousness, for stress, for other kinds of pain besides migraines. But this specifically right now, we're just talking about migraines. So how bad is it from a scale of 1 to 10? So let's say I give it right now a 7. At the end, after you do, there's a set of points, you can go through them a few times. It's not about just doing it once. So you can go through the same set of points 3, 4, 5 times, as many times as you want. And then afterwards, okay, from a scale of 1 to 10, how bad is it? And that can be a nice way to sort of gauge, is this helping at all? And how much is it helping? And if you do it a few times, a few different days, then you can figure out, is this getting better? Is it working better for me now? Or is it not working at all? So here's an acronym that I find, that I put together that I think is helpful. So vets check pets, right? Notice that check isn't spelled out all the way. Pets isn't spelled out all the way, but it's the best I could come up with right now. So here's the first point, vertex. Vertex is at the top of your head. It's the highest point on your head. And it's great for clearing the mind, clearing also the sinuses, and also lifting energy up. You can find the highest point on the top of your head. You can also just consider it right over the top of your ear. Feel around though. For me, I don't feel like I really need that point, but there's a point further back that feels really good to me. So honestly, I usually end up doing whatever feels good, and I think you should do the same. Whatever feels good, your body knows what's best. Next point is eyes. So there are 2 points for the eyes. One is the third eye, and for everybody that's different, but it can be anywhere from the top of your nose to the hairline. And what you can do is you can use a few fingers just to get all those points if you like, and you can use one hand or both hands. I think it kind of feels better for me if I use both hands. The second eye point is the eyebrows, right? There are a few points on the eyebrows. They also clear the sinuses, clear the eyes. So next, vertex, eyes, temple. Temple is right here, just outside of the eyes in this fleshy area. You'll feel a bone here and then a fleshy area here. Again, for me, doing it right next to the eye doesn't seem to do as much as going back a little. There's a point that really feels good if I go back a little. So everybody's different. Find the point that you like, okay? So the temples are great for dizziness. A lot of people have dizziness with their migraines. Dizziness, and also relaxing these muscles here and the jaw muscles and the upper traps. It's all connected here. So the fourth point is sternum, and You can use one hand or both, and find a spot on your sternum that feels good. Sternum goes from here all the way to the bottom of your chest. So from your collarbone to the bottom of your chest. And there are a lot of acupuncture points there. I like to just find the one that feels good to me. That's an area that's often overlooked. If you press hard, you might even find that there's like tenderness there that radiates to your shoulder blade or to your back. And the whole rib cage tends to be overlooked. So I think it's really nice to, mind your rib cage, especially when things are a little bit off. Okay, so that was the first set of points. Vertex, eyes, temple, sternum. Next, we get to cheeks and collarbone. So cheeks, the cheekbone is here. You can tap, officially the point is under the cheekbone, but for me, I like to tap on the cheekbone, and I like to tap the whole thing instead of just the front of it. So there's the stomach channel here and the small intestine channel. So this can help, along with the next point I'm going to show you, it can help with nausea. A lot of people have nausea when they have migraines. So that's cheeks for you. Find where it feels good. Collarbone, you can go under your collarbone, and you can tap with a few fingers there. This point also is great for nausea. So next set of points, let's check pets, pinky, thumb, sides. So pinky and thumb are not actually on the pinky and thumb, but they're close to it. They're on this this metacarpal bone that comes off of the pinky, and this metacarpal bone that comes off of the thumb, or off of it. I'll show you. So anyway, here's the pinky point. You can just tap this whole bone. If you palpate, if you feel along this bone, you might even find a spot that feels tender and it feels like a little bump on the bone. A lot of people who have neck pain or pain between the shoulder blades will have a spot there that's actually really tense. You can even take one of those 25-cent rubber balls and put it on the table and sort of, give yourself a self-massage on that point if it feels good to you. If you go to acupuncture, your acupuncturist might needle that point, and it can relieve neck pain. So that's pinky. Thumb is actually in this fleshy area next to the bone of the thumb, between the thumb and the forefinger. Same idea though, you can feel this bone that comes off of the forefinger and look for a bump that kind of hurts when you press it. And when you find it, you can, if you like, focus on these areas on the bone, go to the neck and the lower back. The fleshy area and this point in general goes to the teeth, the front of the face, the large intestine channel. So it's great for those headaches that are in the front. And if your teeth are affected, of course, it's great for that. The next and last point is sides. So you can find the seam of your shirt and basically tap all around there. I use the side of my hand. You can use the palm of your hand too if you can reach. You can get your thumb out of the way if you're using the side of your hand and just do that. The ribs and the chest are I feel like we kind of ignore them, and they're actually supposed to be really movable. All of those joints need to move, and when we're stressed out, they can get really stiff. So it's great to treat these points. We have we have spleen and liver and gallbladder points here, which can be great. The gallbladder channel is a big one in headaches because I feel like, especially in New York, the most common headache is the one that affects the temples and behind the eyes, and might also come with jaw pain or upper traps pain in the neck here. And those people may or may not also have sciatica. So let's say you're not interested in tapping. It's too high energy for you, or it just doesn't work for you. You can also, especially with the points on your head, you can hold those points. So contact them with both hands and hold them. And this is very subtle, so you have to be still or maybe lying down or sitting. And when you're holding them, you feel for a pulsation. And at first, the point, especially if the point is, needing work, that pulsation will be uneven. From the right to the left hand, you'll feel different things at different times, but you keep holding it and eventually it will even out and become symmetrical. And when it does, then just hold it for a few more seconds and then you can move on to the next point. that's a great system. There's so much that you can do with holding and with touch. If you're interested in learning about that, you can look up Touch for Health. It's a system that teaches you channel theory and allows you basically to treat yourself and others using these self-care techniques, the same way an acupuncturist would treat the channels, except that you're not using needles, you're using your hands. So a quick recap: vets, check, pets. Let's go through it really quick. Vertex, eyes, eyebrows, temples, sternum, cheeks, collarbone, pinky. So for these pinky points, you can tap with one hand and then switch and tap the other hand, or some people like to do like this. Do whatever feels better. For me, this feels better. Same with the thumb. So you tap with one hand and then you switch, tap the other hand. But some people will actually go like this. If that works for your body, then by all means. And then lastly, sides. So that's great. We have 7, 8, 9 points. Vets, check, pets. If you have a better acronym, please share it in the comments. I'm sure there is a better acronym. And yeah, let us know how this goes. Let us know your pain score before and after, from 1 to 10. And if there's another variation that you enjoy, please share it. Thanks.